for our introduction.
Great, thanks Tricia, and good afternoon everyone. My name is Robert Trachtenberg and I'm the CEO of the National AHEC Organization, which is the member association of AHECs nationwide. Thank you all for joining us in the first of a series of webinars related to HPV immunization. Today's webinar, Countering HPV Vaccination Opposition, promises to be excellent and quite thought-provoking. Before I introduce today's speaker and we get started, I'd like to spend a moment or two providing a brief thumbnail sketch of the National AHEC Organization and the AHEC program for our guests today who work outside of the AHEC network. The Area Health Education Program, or AHEC, enhances access to high-quality, culturally competent healthcare through community-based, interprofessional, interdisciplinary training, continuing education, and health careers outreach activities that ultimately will improve the distribution, diversity, and supply of the primary care health professions workforce who serve in rural, underserved areas and provide healthcare delivery sites. This map indicates the states that are participating in the NAO HPV immunization project as of year one. Year one effectively started September 30th, 2014. So you can see that most of the states throughout the country are participating in our immunization project, and we expect that most of the additional states will be on board in the coming years. The National AHEC Organization HPV Immunization Project is the title of our project, and this project will work in partnership with the Centers for Disease Control and Prevention to improve HPV immunization rates of 11 and 12-year-old males and females throughout the country by improving clinician training and understanding of the vaccine. NAO, along with the American Cancer Society, Academic Pediatric Association, and American Academy of Pediatrics, were awarded in 2014 a 5-year cooperative agreement with the CDC to raise HPV immunization rates throughout the country. A brief disclaimer before I introduce today's speaker. The views expressed here in this webinar do not necessarily reflect the official policies of the United States Department of Health and Human Services and the Centers for Disease Control and Prevention. Our speaker for today's webinar, Aubrey Villalobos, MPH, MED, is the Director of the Comprehensive Cancer Control at the George Washington University Cancer Institute. The GW Cancer Institute is a vitally important partner of NAO's on our national HPV initiative, and I'm thrilled to turn it over to Aubrey. Aubrey?
Hi, Rob. Hi, everyone. Thank you so much. So here are today's learning objectives. We'll just dive right in. I'm hoping that after today's webinar, the participants will be able to summarize the emergence and evolution of the anti-vaccine movement here in the U.S., that they'll be able to identify modern sources of anti-vaccine propaganda and misinformation, confidently debunk vaccine myths and counter anti-vaccination arguments, as well as evaluate the validity of source information about vaccinations. But before we dive into that, I want to give a little bit of a history about GW Cancer Institute. We have a number of new colleagues joining us today. So GW Cancer Institute was founded in 2003. We are part of the George Washington University School of Medicine and Health Sciences, and our mission is to foster healthy communities, prepared patients, responsive healthcare professionals, and supportive healthcare systems through applied cancer research, education, advocacy, and translation of evidence to practice. This chart summarizes our 3 main program and focus areas. You can see that we work in comprehensive cancer control, patient-centered programs, including cancer survivorship and patient navigation, and policy and engagement, including work on access to care. In our comprehensive cancer control house is where we focus on a lot of prevention initiatives, including HPV vaccination research and education. As Rob mentioned, this project is part of a CDC cooperative agreement, and we are working with the National AHEC Organization to accomplish their goals on this project. And so to do that, we first developed the HPV vaccination resource book to provide Area Health Education Center regional coordinators with an overview of human papillomaviruses, the associated disease burden, and probably more importantly, factors surrounding the acceptance of HPV vaccination. We also designed an environmental scan protocol to help AHEC regional coordinators gather additional useful information about HPV to better support states in their region, including facilitating provider outreach and professional education to help increase HPV vaccination rates. And you can download both of these documents at the links on the slide. As a supplement, we also developed this webinar training series. The first webinar was on the effective use of the environmental scan protocol, and the second was on understanding the HPV resource book and the state-specific HPV cancer prevention profiles that we developed. This is the third webinar in this training series, and we're focusing on countering vaccine opposition. So let's start with a little history. In 1796, Edward Jenner demonstrated that he could protect a child from smallpox if he infected him with lymph from a cowpox blister. This worked consistently among 13 children in his initial experiments, which eventually led to our first modern vaccine, and later the eradication of smallpox. According to the College of Physicians of Philadelphia, who maintain historyofvaccines.org, they say that Jenner's ideas were novel for his time, however, and they were met with immediate public criticism. The rationale for this criticism varied and included sanitary, religious, scientific, and political objections. Jenner called this procedure that he had developed vaccination, derived from the Latin root vaccinus, meaning from cows. Jenner has been regarded not only for beginning the vaccine era, but for also establishing a foundation for the study of immunology. And of course, not all vaccines are now related to cowpox, but that is where the history lies. Despite his success, he was faced with great criticism and opposition. During that time, three major opposing arguments were made regarding Jenner's new preventive procedure. There was one group of individuals who believed the vaccine was unchristian because it came from an animal. There was another group who simply did not feel safe or sanitary injecting their children with lymph from the scab of a person that had been infected. And in addition, there were opponents who later rationalized that natural immunity was better than acquired immunity or vaccination. And finally, others who felt it was a violation of personal liberty. Each of these different arguments laid the foundation for what became the anti-vaccination movement. Before we jump into that discussion, I want to make sure that we're all on the same page about the most basic understanding of how vaccines are designed to work. Vaccines reduce the risk of disease by working with the body's natural defenses to help it safely develop immunity. Vaccines contain the same germs that cause disease, but they've either been deactivated or weakened to the point that they don't make you sick. The exposure to these weaker germs stimulates the immune system to produce antibodies, exactly like the body would if exposed to the real disease, but with very minor side effects because the germ is weakened. After being vaccinated, a person develops immunity to that disease without having to have the disease first. The immune system will remember that antigen, and if the body encounters it in the future, it will respond quickly and powerfully enough to keep it from causing the disease. After getting a vaccine, the imitation of infection can cause minor symptoms like a fever. Such minor symptoms are normal and expected as the body builds immunity. Different vaccines have slightly different levels of effectiveness in producing immunity, and this is one of the factors used by the Food and Drug Administration when considering licensing new vaccines. Vaccines are one of our greatest public health achievements. Over the years, vaccines have prevented countless cases of disease and saved millions of lives. Because of vaccines, smallpox has been eradicated since 1977. The polio virus is also on the verge of eradication. And according to the CDC, in 2012, only 223 confirmed cases of polio were reported worldwide. Also, incidents of diphtheria, congenital rubella, and influenza type B have all decreased by almost 100% in the United States, thanks to widespread vaccination. In addition to preventing illness and death in individuals, vaccination also has the potential to establish herd immunity. Herd immunity is the resistance to disease that develops in an entire community when a sufficient number of individuals are vaccinated. This form of immunity can provide a measure of protection for those who are immunocompromised or otherwise medically unable to receive the vaccine. The greater the number of individuals in a community who are immune to a disease, the smaller the odds for individuals who aren't immune to come in contact with the disease. So with that, I hope that we all have a common understanding, and we'll move on from here into talking about anti-vaccination. So after Jenner's cowpox experiments in the late 1700s, in 1853, England introduced the first compulsory vaccination act, which mandated that infants up to 3 months old be vaccinated against the smallpox virus. Similarly, during the 1850s, the first school vaccination requirement was enacted in Massachusetts in the United States to prevent the spread of smallpox in schools. In 1867, England expanded their smallpox vaccine mandate up until age 14. Penalties for parents who refused to vaccinate included fines and imprisonment. These laws stimulated the rising of an opposing group who believed vaccine mandates were unconstitutional and violated their personal liberty. The anti-vaccine movement later spread to the U.S. with the formation of the Anti-Vaccination Society of America in 1879 and the Anti-Vaccination League of New York City in 1885. These movements were sparked by feelings that vaccines cause illness rather than protect against them, that they go against religious beliefs, may reduce immunity, and that vaccine mandates are an infringement on personal liberty. In the U.S., this personal liberty argument was cited as violations against the Constitution's First Amendment, which forbids Congress from making laws that restrict an individual's religious practices, freedom of speech, freedom of press, and the right to petition the government for redress of grievances. And also the 14th Amendment, you'll also hear, which forbids states from denying any person life, liberty, or property without due process of law. Pressure from the anti-vaccination movement later led to a new Vaccination Act in 1898 in England, which removed the penalties associated with failure to vaccinate and also included a conscientious objector clause, which afforded parents the right to exempt their children from the vaccine. So you'll see that this movement has deep roots and they've been around for a long time. So I just want to talk about one thing here for a moment. One camp of anti-vaccinationists believes that vaccine mandates are an infringement on personal liberties, so let's talk about the premise for vaccine mandates in general. They believe that the government has no right to interfere with a parent's decision to vaccinate their child. However, under the United States Constitution's 10th Amendment, which delineates the division of power between the federal and state governments, the doctrine of state police power was adopted from firmly established English common law principles mandating the limitation of private rights when needed for the preservation of the common good. The application of police power has traditionally implied a capacity to promote public health, morals, or safety and the general well-being of the community, to enact and enforce laws for the promotion of the general welfare, to regulate private rights in the public interest, and extend measures to all great public needs. Examples include quarantines, thinking about the recent Ebola outbreak, seatbelt and helmet laws, and vaccination mandates. Immunization mandates have been challenged multiple times with legal precedent being established first in the 1907 Jacobson versus Massachusetts case. The court held that a health regulation requiring smallpox vaccination was a reasonable exercise of the state's police power, and it did not violate the liberty of the individual under the 14th Amendment to the U.S. Constitution. This decision has served as the foundation for all following vaccine mandate challenges. Vaccination mandates have proven to be the most effective tool in protecting children and adults from the effects of vaccine-preventable disease. It's been said that vaccines and recommended immunizations have saved more lives than any surgical techniques or medication, including antibiotics. These laws have increased coverage rates among children, reduced racial and ethnic disparities among school-age children, and decreased the incidence of infectious disease. So now that you understand a little bit about the history of the movement and some of the foundation for mandates, let's look at common myths that the opposition movement tries to perpetuate and see where the myths come from. Vaccine misinformation can originate from scientifically limited studies and more commonly from anecdotal events reported by patients and parents. These often inaccurately reported events are frequently the results returned when you conduct any search online on vaccine safety. These emotional reports can have a tremendous impact on an already hesitant or new parent's decision whether or not to vaccinate their child. Illustrating this point, a 2013 systematic review found that participants' healthcare judgments and decisions differed depending on whether or not the decision aid they were using included a patient story. Most of the vaccine injuries reported have no connection to immunizations other than coincidental timing with the administration of the vaccine, and we'll talk much more about this later on. For example, some say the rise in autism rates coincided with the time that the MMR vaccine was first licensed, and by some that was enough evidence to say that the vaccine caused autism. However, further scientific evidence shows there's no causal association between the two, and we'll dig into that more in a bit. Similarly, parents believe that pneumonia, a middle ear infection, cough or cold, eczema, asthma, epilepsy, and other unrelated conditions were vaccine injuries simply because of the timing that the child had one of those conditions related to when they were vaccinated. Finally, due to low levels of health literacy in the United States, many parents have difficulties understanding scientific findings and often become frustrated by dense writing and unfamiliar jargon. Uninformed parents will more likely click on attention-grabbing blog posts with anecdotal patient stories before reading a dry, peer-reviewed research article. Ultimately, misunderstandings about dosage and toxicity and medical misconceptions can result in huge leaps in logic for these people. Although the Vaccination Act of 1898 was a tremendous success for anti-vaccinationists in England, it removed the penalties and opening the doors to opt-outs, but the anti-vaccination movement was still very active. About a century later, one of the most historically impactful anti-vaccinationists, Dr. Andrew Wakefield, published an article that still influences vaccine decisions today. In 1998, the British surgeon and medical researcher published a study in peer-reviewed academic journal The Lancet, claiming to have found a connection between the measles, mumps, and rubella vaccine and the onset of autism. After a decade-long investigation, researchers concluded there was no causal relationship between any licensed vaccines and autism. Dr. Wakefield's paper was partially retracted in 2004 and fully retracted in 2010 due to the paper's scientific limitations, which included lacking a control group, relying on parents' memories for vaccination records, vague conclusions not based on statistics, and the use of a small sample size of 12 children as test subjects. It was also later discovered that Wakefield's data was actually fabricated, altering the medical histories of all 12 of the patients whose cases formed the basis of his study. The British Medical Journal published a report by Brian Deere, a British journalist, who found that after examining the records, the original records for all 12 children used in Dr. Wakefield's study, the statements made in his report did not match the numbers from the patient records. Despite this, Wakefield's study has already instilled a belief among some parents and doctors looking for answers about autism, and this belief perpetuates today. According to reporters Kathleen Seidel and Brian Deere, like Dr. Wakefield, Drs. Mark and David Geyer were hired by American lawyers running a vast legal attack not only against MMR vaccines, but on many other vaccines. Their research report into a link between mercury and other vaccine ingredients and autism was also retracted in 2007 following inquiries into data, ethical, and conflict of interest in issues, very reminiscent of Wakefield's problems. So you can see that the source of a lot of these myths is bad science and anecdotes. So let's talk now about what some of the most common myths are and break them down one by one. First, we're going to look at some general vaccine myths and then look at myths specific to the HPV vaccine. One of the most common myths is the claim that vaccines don't work. Based on extensive data, the CDC reports that vaccines produce immunity 90 to 100% of the time. All vaccines must undergo extensive comparative testing, and unless the vaccinated groups are much less likely to get the disease, the vaccine will not be licensed by the FDA. Studies have shown that the HPV-9 vaccine prevents infections with 9 cancer-causing HPV types with 98% effectiveness. This protection has been found to last for 10 years or more without losing effectiveness. When considering meningitis, for example, prior to the Hib vaccine in 1990, there were 15,000 cases and 400 to 500 deaths every year from the bacterium. After the vaccine was introduced, meningitis incidence declined to fewer than 50 cases per year. The same disease decline was seen in the cases of polio and measles. Another myth commonly told about vaccines is that they can cause autism. As I mentioned, this source of misinformation originated from a study by Dr. Andrew Wakefield that was published and later retracted. Between 1999 and 2012, several large-scale studies were conducted which all concluded that there was no causal relationship between vaccines and autism. One of the largest studies that disproved Wakefield's 12-patient fabricated study was a 2012 meta-analysis of 14,700,000 children, which also concluded that there was no causal relationship between vaccines and autism. A related and currently circulating myth is that the use of acetaminophen, Tylenol, after the MMR vaccination may cause autism in children. This myth was introduced by a study conducted in 2008 by Stephen Schultz and colleagues. However, a 2009 letter to the editors in response to Schultz's study suggests that there were fatal flaws in the study design and no such inference could have ever been made. A third myth perpetuated by anti-vaxxers is that vaccine ingredients, thimerosal, aluminum, and formaldehyde are toxic to the body. This is also untrue. Mercury is a naturally occurring element found in the Earth's crust, air, soil, and water. 2 types of mercury to which people may be exposed exist: methylmercury and ethylmercury. They're very different. The preservative thimerosal does not contain methylmercury, which is associated with damage to the nervous system, but thimerosal rather includes ethylmercury, which is not harmful except in a very rare case of allergy. So with the exception of multi-dose flu shots, thimerosal has been removed from all routine childhood vaccinations since 2001 for assured safety because of public concerns. As for concerns of formaldehyde, another naturally occurring organic compound, there are greater levels of formaldehyde in the normal bloodstream than there are in vaccines. Formaldehyde is used in the vaccine to inactivate the viruses and detoxify the bacterial toxins so that they don't cause disease. So it's a very important ingredient for the vaccine to work. Aluminum is a common metal found in nature, and infants actually get more aluminum through breast milk or formula than through vaccines. Aluminum is used in vaccines as a component that boosts the immune system response to the antigen and allows for lesser quantities of the vaccine and fewer doses, another very important ingredient. For the HPV vaccine specifically, Gardasil, Gardasil 9, and Cervarix all contain ingredients that have been proven to be safe. Like the hepatitis B and Tdap vaccines, HPV vaccines contain a small amount of aluminum, as an adjuvant that boosts the body's immune system to the vaccine. In addition to certain vaccines, aluminum is found in breast milk, as I mentioned, infant formula, antacids, numerous foods and beverages, including fruits and vegetables, beer and wine, seasonings, flours, cereals, nuts, dairy products, and honey. Typical adults ingest 7 to 9 milligrams of aluminum per day, whereas the HPV vaccines contain 0.225 milligrams of aluminum per dose. And you only get 3 doses. Given the quantities of aluminum we are exposed to on a daily basis, the quantity of aluminum in vaccines is minuscule. Aluminum-containing vaccines have been used for decades and have been given to over 1 billion people worldwide without a problem. In the spring of 2000, the National Vaccine Program Office reviewed aluminum exposure through vaccines and determined that no changes to vaccine recommendations were needed based on aluminum content. Also, the Global Advisory Committee on Vaccine Safety, part of the World Health Organization, has reviewed studies and also found no evidence of health risks that would require changes to vaccine policy. Another general myth about vaccines is that young children are too young for vaccines. According to the CDC, babies are exposed to thousands of germs and other antigens in the environment from the time they're born. When a baby is born, his or her immune system is ready to respond to the many antigens in the environment and the selected antigens in vaccines. Some parents may believe infants' immune systems are too weak and can be easily overwhelmed by multiple vaccinations, which is why some parents choose to delay and draw out their children's vaccine schedules. Scientific data show that getting several vaccines at the same time does not cause any chronic health problems. A number of studies have been done to look at the effects of giving various combinations of vaccines, and when every new vaccine is licensed, it has been tested along with other vaccines recommended for that particular age group. The recommended vaccines have been shown to be as effective in combination as they are individually. From the moment babies are born, they're exposed to numerous bacteria and viruses on a daily basis. Eating food introduces new bacteria into the body. Numerous bacteria live in the mouth and the nose, and an infant places his or her hands and mouth on other objects all throughout the day, exposing the immune system to even more germs. When a child in elementary school has a cold, he or she is exposed to up to 10 antigens. And if you think about strep throat, as winter is nearing, that's 25 to 50 antigens. Each vaccine in the childhood vaccination schedule has between 1 to 69 antigens in just that vaccine. So this is not something that is likely to overwhelm the immune system, and the Institute of Medicine agrees that antigens in vaccines are not significant enough to suppress the immune system or cause any weakness. Another longstanding myth is that natural immunity is the safest option because it's natural. Natural infection usually does cause better immunity than vaccination. However, many of the alleged means by which to infect a child, such as chickenpox parties, are ineffective and dangerous. Vaccines, on the other hand, are designed to prevent diseases without the symptoms of the dangerous infection. When relying on natural immunity, many diseases that have been virtually eradicated have the potential to resurge, which has been seen with whooping cough lately and measles outbreaks in the United States in recent years. 15 years after CDC declared the U.S. free of measles, the U.S. experienced a large multi-state measles outbreak linked to an amusement park in California in 2015. The outbreak likely started from a traveler who became infected overseas with measles, then visited the amusement park while infectious. This resurgence was largely attributed to non-vaccinators. Failing to vaccinate not only leads to resurgence, but impedes herd immunity, which we talked about earlier. Some anti-vaccination campaigns claim that vaccines are just broadly not safe, and this is simply untrue. As previously stated, vaccines must undergo extensive testing through clinical trials to show not only that they're effective, but that they're safe in order to be licensed by the FDA. Although vaccines, like any other medicine, can still cause a reaction, these reactions are typically minor, such as a mild fever, slight rash, and soreness at the site of injection, all things that are expected when you're priming the immune system to recognize a particular antigen. Looking at HPV specifically, reports indicate that of the 67 million who received HPV vaccines between 2006 and 2011, approximately 25,000, so less than 1%, experienced adverse effects. 92% of those adverse effects were non-serious. Although it's been rumored that these adverse effects may include infertility in women, I just want to address this right now. There is no data to validate that claim. Cervical cancer treatment puts a woman at risk for problems with her cervix, and so getting the HPV vaccination to prevent cervical cancer might actually be a protective factor for a woman's fertility success. This list of myths that we just covered are common to most vaccines, including the HPV vaccine. For additional HPV-specific myths, along with some very strong counter-arguments, I want you to refer to the American Cancer Society's HPV Vaccinating Adolescents Against Cancers project, myth-busting handout. This handout was provided to AHEC regional coordinators at their kickoff training in Atlanta earlier this year, and it covers 11 myths and provides the facts to refute them and tailored talking points providers can use with parents. Right now we're going to take a look at a few. If you want to download the full handout, it should be available in the files pod of the webinar. This first myth is for AHEC specifically to remember when they're doing clinician outreach. The myth is that people already know about the HPV vaccine and will ask for it if they want it. The fact is that studies on the vaccine have shown that up to 60% of parents have no prior knowledge about the HPV vaccine before their child's provider teaches them about it. So you might say, AHECs might say to providers that a strong provider recommendation is the single best predictor of vaccination. So now let's look at common myths AHECs or providers might encounter. Myth: the HPV vaccine is unsafe. Fact: prior to FDA licensing the HPV vaccines, nearly 60,000 men and women were studied to ensure vaccine safety, and both the FDA and the CDC continuously monitor vaccine safety. Recently, published research looked at emergency room visits and hospitalizations for 60 days following the vaccination. The research found that more than 200 categories of illness were reviewed, and in almost all cases, the condition existed prior to vaccination. So getting the vaccine did not increase the likelihood of developing these adverse conditions. The talking point: the vaccine has been rigorously tested and is safe. I know I keep repeating this, but it's the biggest one to dispel. Since 2006, about 70 million doses of HPV vaccines have been distributed in the U.S. and more than 100 million doses worldwide. The safety is continuously monitored in 80 countries. No serious safety concerns have been identified. Myth: the HPV vaccine causes serious side effects, including death. Fact: of the 14 deaths recorded among girls and women in the FDA study of the HPV vaccine, the causes included car accidents, congenital heart problems, suicide, lupus, and pneumonia, and were not linked to the vaccine. Globally, over 100 million doses of the vaccine have been given in more than 120 countries, and all adverse reactions have been monitored and investigated. All vaccines can have side effects. The reactions that people have had after the HPV vaccines are similar to those from other vaccines. So you might say, again, the vaccine has been rigorously tested and is safe. The vaccine was tested in numerous clinical trials and proven to be safe and continues to be monitored for safety. Just like other vaccines, minor swelling or redness at the site of injection can occur with the HPV vaccine. The most common side effects are pain, redness, and or swelling at the site of injection. Very rarely, more serious side effects such as anaphylactic or allergic reaction can occur. usually if a person's allergic to an ingredient in the vaccine, such as yeast. Myth: the HPV vaccine is ineffective. In initial clinical trials, the vaccine was given to 20,000 women ages 16 to 26 in 33 countries, including Australia. These trials showed the vaccine is almost 100% effective in preventing abnormalities in cells in the cervix caused by high-risk HPV types 16 and 18 in particular. Those abnormalities are a proven precursor to cervical cancer. Further clinical trials involving more than 4,000 males aged 16 to 26 from 18 countries showed the vaccine was 90% effective in preventing genital warts and abnormalities associated with penile cancer, and 78% effective in preventing anal disease caused by HPV types 6, 11, 16, and 18. So you might say, the HPV vaccine is highly effective in preventing HPV-caused cervical, anal, and penile cancers, as well as genital warts. Numerous clinical trials have proven the vaccine's effectiveness in preventing HPV-caused cervical cancer, as well as these other cancers. And in addition, studies in the U.S. and other countries have introduced the HPV vaccine and have shown a significant reduction in infections caused by these HPV types that are included in the vaccine. So it is working. Myth: the HPV vaccine is unnecessary unless you're sexually active. So the fact here is that vaccines are for prevention, not treatment, so they only work if given before coming in contact with the virus. Getting vaccinated against HPV before the risk of exposure, such as sexual activity, is important. Research shows that younger people create more antibodies to the vaccine than those in their late teens. This means that those who are vaccinated are better protected if they're exposed to HPV in the future. Note here that CDC research shows and recommends that providers avoid talking about sex with parents unless it's explicitly brought up by the parent. So to counter this myth, the best thing to focus on is that the vaccine is more robust in the target age range. So you might say something like, we vaccinate people well before they're exposed to an infection, such as measles and the other recommended childhood vaccines. Similarly, we want to vaccinate people before they're exposed to HPV. The HPV vaccine produces a higher immune response in preteens than it does in older teens and young women. The vaccine prevents twice as much cervical precancer when given by age 14 than it does after age 15. HPV is so common that almost everyone will be infected at some point in their lives. It is estimated that 79 million Americans are currently infected and that there are 14 million new infections every year. Most people who are infected will never know it. So if your child delays sexual activity until marriage or only has one partner in the future, they could still be exposed if their partner has been exposed. The HPV vaccine is only for females. I'm going to go quickly through these last few here because once you have the handout, you can read through them yourself. But the talking point here is that the HPV vaccine is strongly recommended for males and females, and that there's data to show that it is effective in both of those groups. Another big myth that HPV vaccine encourages sexual activity. This is also not true. And the talking point here is that experience shows that the vaccine does not increase sexual activity, and we have the data to back that up. So I encourage you to look at the handout to review that. For the clinicians on the webinar today, the CDC also has developed some really handy quick reference tools that they want you to take a look at. These are designed to help you talk with parents about the HPV vaccine. So please visit their You Are the Key website, linked here to learn more. So now that we've covered myths, I want to quickly discuss propaganda. So generally speaking, there are several sources of modern anti-vaccination propaganda, including websites, celebrities, social media, and journal articles. And they all have the ability to circulate these myths that we've talked about and significantly impact the public's perception of vaccination. So for years, celebrities and public figures have served as health advocates or adversaries in the media. According to a University of Michigan survey, 24% of Americans place some trust and 2% place a lot of trust in the information provided by celebrities on vaccine safety. Among those who've publicly advocated support for childhood vaccinations, you can see those here, President Obama, Microsoft co-founder Bill Gates, and some actresses. There are also well-known figures, including presidential candidate Donald Trump, model and TV host Jenny McCarthy, and some other actors and actresses, as well as environmental activist Erin Brockovich, who've all publicly spoken against childhood vaccinations. Among those that have received a tremendous amount of attention are Alicia Silverstone and Jenny McCarthy. Alicia Silverstone, who ironically is known for her role in the 90s movie Clueless, recently published a parenting book called The Kind Mama, which contains anecdote-based parenting stories for expecting mothers, including a section against vaccination. Jenny McCarthy also has a loud microphone on this issue and is well known for her claims about MMR vaccines causing autism in her son, Evan. She even established a nonprofit called Generation Rescue, which provides support to families of children with autism and propagates the belief that autism and related disorders are caused by vaccines. And in 2008, she held a large rally called Green Our Vaccines, which called for the removal of all toxins from vaccines. So she's definitely made a lot of headlines on this issue. Many celebrities and individuals in the general public use social media, including particularly Twitter, Facebook, and YouTube as platforms to share anti-vaccination messaging. And this, again, has the potential to significantly impact public perception because, for example, these celebrities have large followings, but then also if you see a tweet favorited or retweeted by someone that you trust, you're more likely to believe it. So although there are a great number of celebrities who use social media to advocate against vaccines, there are others who use social sites to debunk myths and educate others to promote awareness. So I want to take a quick look at a case study of a celebrity who did a 180 on her position on vaccines. So Kristen Bell is a popular actress and singer, and she and her husband, Dax Shepard, were originally highly publicized vaccine skeptics. However, in a recent interview, she said that having children promoted her to do some research in which she found that there's actually an important reason why we all need to vaccinate, citing herd immunity and the greater good for the community. So both Kristen and Dax have been increasingly outspoken about their pro-vaccination beliefs in interviews as well as on social media and have a large following. They got a lot of attention because both of them insisted that friends and family be up to date on their vaccines before holding either of their children when they were newborn. This couple is a great example of how effective educational interventions are in changing knowledge and attitudes and beliefs, which ultimately helps to increase vaccination coverage. They're a model of how stardom and popularity can be used to positively influence others. And there's a link at the bottom here for stories from regular parents who have reversed from anti-vaccination for pro-vaccination. Go to voicesforvaccines.org. So speaking of websites, unfortunately there are several websites and organizations that are dedicated to this anti-vaccination movement. There's a host of them listed here. Some just perpetuate myths and misinformation. Others, like the National Vaccine Information Center, has a searchable memorial for vaccine victims. And so, as we were talking about before, these sites, they are perpetuating these myths and relying on the sort of anecdotal patient stories to push the movement forward. To counter that, there are a number of reliable and helpful websites for your HPV vaccination information seeking. The CDC, the NIH National Institute of Allergy and Infectious Diseases, National Vaccine Advisory Committee are all listed here. Immunize.org is the website for the Immunization Action Coalition. They have both immunize.org is for health professionals, and vaccineinformation.org, they also run, is for the public. And then I already mentioned Voices for Vaccines. Unfortunately, journal articles written by physicians and scientists have also been an influential source of anti-vaccination propaganda. There have been multiple studies published, and we've talked about some of them, but similar to those journal articles, there are also celebrity doctors who speak openly about their anti-vaccine stance on television and radio. Doctors like Dr. Oz, Dr. Mercola, Dr. Sears, they give credence to the other side of the debate by allowing airtime and discussion of the controversy when there truly isn't a controversy as far as the vast majority of the scientific community is concerned. So I want to give you a couple strategies for validating some of this information. Knowing bad science is the best way to determine which findings and reports are truly reliable. So for journal articles, you should be able to answer these questions in order to help you determine whether or not the source of information is reliable. You can also look in published journals for related commentaries from other researchers in the journal's opinion section to see if the study has been criticized and why, and then make an informed decision about whether or not to, to take it as face value. For websites, here are some key principles to think about. Health on the Net was developed to encourage the dissemination of quality health information, and these are the principles that they use in validating websites. So you don't always have to see the logo up there on the screen on the site, but you can use these same principles to be able to determine whether or not the website is valid. So I know we don't have much time left, but I just want to walk you through one example here to put your knowledge to the test. So this, let's take a look at this article. It's titled Gardasil Vaccine, One More Girl Dead. Is this article a reliable source of information? Let's look at a few points. So the first thing you notice here is this picture, again, going for the emotional distraction. You'll also notice that the recent coincidental timing, so she was dead within hours of administration of the vaccine. And then the date line on the article here, you'll see, was from the day that I made these slides. So this website has all of their articles set to automatically update the dates to make you think that the information is brand new. But upon further investigation, this story is well over a year old. And then the links in here for their references one is a broken link, the other one goes to a story, a news story that does not match what they're saying it should. As well as when you go down the page further, you'll see that there's YouTube rants linked, other anti-vaccination websites, and the author explicitly says you can't trust the CDC. Further down on the page, you see advertisements for 2 clearly anti-vaccination books. And so I think you can safely say that this article is a very biased piece of, quote, reporting and isn't reliable. So there you have it. But not all articles you come across will be so easy to detect. And so I encourage you to, keep your guard up. So we're about to wrap up, but I just wanted to share with you a few visuals to see how some people are using anti-vaccination propaganda tactics to support vaccination. So this photo mocks the general approach and scare tactics used by many anti-vaccination proponents for how they design some of their propaganda, and I'll just give you a second to take a look at that. Here's an example of an anti-vaccination poster, and it has been photoshopped to be pro-vaccine. So, some folks are using their sort of anti-vaccination tactics against them. And then finally, this poster looks like it would be anti-vaccine, so it might catch someone who's against vaccines. It might catch their attention in their news feed. But once you read through it, you see that it is very much in support of vaccination. So I know this was a lot of content today. I sincerely hope that you found it helpful. And I'm happy to take any questions now if we have a little bit of time left. Thank you.
Thank you very much, Aubrey. We very much appreciate the information that you've shared today, and more importantly, of all our partnership with the George Washington University Cancer Institute. I have a sneaking suspicion that after the webinar, we will have some folks who will be emailing questions, because as you stated, there was a great deal of information provided today. So thank you very much. We especially want to thank everyone for attending our webinar today. As we finish up, we'd of course like you to complete the closing polls, which many people are used to doing, and so you've quickly done that. We appreciate your time and input. It's very valuable as we continue to plan for future programs. Please remember that you can reach us at NAO at any time by emailing info@ntc.nationalahec.org with any questions or concerns that you have about this presentation today. The webinar has been recorded, and we will be offering that archived webinar on demand within a week. We will send you a notification of that so that you can share it with others that you work with or folks who unfortunately were unable to attend. Again, we thank you very much for attending, and we hope to see you in the future for other webinars that we may have. Rob, do you have any other closing comments?
My only final closing comment is thank you all for participating on the first in a series of webinars, as Gretchen mentioned. We appreciate you being on today, and Aubrey, great job, and the team, great job, and we look forward to working with you all as our participants in the future.